Now I'm going to be demonstrating how to hang a PiggyBack medication while there's a primary up. Apparently there would be a primary up. The first thing I'm going to do is check my doctor's orders. I'm going to compare that with my patient's lab values and allergy history. I'm looking at the medication that he chose, the dose, route, and frequency, making sure that it's appropriate for this patient. I'm then going to look up my medication. The order is for 1 gram of Rocephin IV over 30 minutes. This is a bactericidal cephalosporin. It's used to treat bacterial infections. My patient is suspected of having an infection, so this is an appropriate medication for them. Some of the side effects include nausea and vomiting and allergic responses. The contraindications for this medication are calcium-containing IV fluids. They have normal saline, so this is appropriate as well, and also Coumadin. Nursing implications for this medication is to inspect every 15 minutes. So I'm going to inspect it twice over the 30 minutes that I'm giving this medication, and to also assess for allergic reactions. The dosage was for 1 gram. I'm going to take my medication, and it says that 2 milliliters is equal to 1 gram of Rocephin. So I'll be drawing up 2 milliliters. This medication expires in January of 2016, so it's in date, so it's okay to use. And my dosage calculation for this is that this medication is going into a 50 milliliter bag over 30 minutes at a drop factor of 10, so that leaves me with 17 drops per minute. So next I can draw up my 2 milliliters of Rocephin, and I'm in the med room. Go ahead and drawing that up, making sure there's no air bubbles. Then going to recap my needle. Now I can go ahead and inject that into my 50 milliliters of saline. So, using sterile procedure, inject my medication. I'm going to dispose of my sharps in a sharps container, and then I can label my medication bag. I'm going to be labeling it with my patient's name, the drug, the dose, the amount, and at what time I started. Next, I'm going to go ahead and go into my patient's room. So I ask my patient their name and date of birth, compare that to my doctor's orders, my MAR, and their wristband. I'm going to inform them that I'm going to be giving them an IV antibiotic to prevent infection. I'm going to ask them again if they have any allergies, just to verify one more time that this is okay to give them. Go ahead and wash my hands, put on my gloves, and then I'm going to assess their IV site that they've got running right now, or the IV line that they've got running right now. The site is without any irritation or inflammation. Doesn't look like they're having an allergic response to the saline that I've got running. Next, what I'm going to do is go ahead and going to lower the primary bag, hang that back up, and then I'm going to go ahead and clamp it so that I can hang my PiggyBack med. I'm going to spike the PiggyBack medication and hang this higher than the primary. At this point, this is clamped as well. So at this point, I've hung my medication, and I'm going to go ahead and prime the tubing, making sure there's no bubbles or anything. I'm then going to label my tubing with my initials, the time and date. I can then attach it to my primary medication, making sure that they're both clamped. Going to find a port lower than the clamp and alcohol swab. Then I'm going to take off my sterile cap off of my PiggyBack medication tubing and attach. Alright, at this this point, I can go ahead and unclamp my PiggyBack medication so that I can establish my drop rate of 17 drops per minute. Looking at a clock and comparing. Once I've got my drop factor set, or my drops per minute set, I can assess the site again, make sure that it doesn't look like anything's infiltrated. I'm going to take off my gloves and wash my hands. And then I'm going to come back in 15 minutes to check the site again, because that's what Stefan calls for, and then come back in 30 minutes when the medication is over, and disconnect the PiggyBack. So for 30 minutes, I come back. I'm going to identify the patient again with their name and date of birth. I'm going to tell them that it's time for me to take down their bag of Restefan, wash my hands, put on my gloves, then going to clamp the PiggyBack, unclamp the primary, and then disconnect my PiggyBack. I would then place an alligator clamp or a sterile clamp onto here so that it can be used later if need be. Then going to reestablish my drop factor rate of 33 drops per minute on my primary bag, and also assess the site for any signs of an allergic reaction or inflammation and swelling. At this point, I can take off my gloves and wash my hands, and then I'm going to be documenting the time, the drug, the dose, and the rate, and then I'm going to be documenting the condition of the IV site, that there is no allergic response to the medication, and as well I'm going to be recording in the intake and output that I placed up that they received 50 milliliters of saline at this time.